back. A lot of times we wind up with lower back tension, we can't really tell where it's from. After a long work week in front of the computer, we'll find that we have sort of nagging back pain, and we find ourselves maybe twisting a little bit, trying to stretch it. It doesn't really work out well. And one of the muscles, from my perspective, that massage therapists even and chiropractors will miss is this gluteus medius muscle. So gluteus maximus is on the back, medius is on the side, minimus is on the front. Max is biggest, med is middle, min is smallest. And if we were to take a look at the bone, it traces a cup shape where these huge muscles end up inserting. Your gluteus maximus is about 1.5 to 2 inches thick at its thickest. Your minimus is about 1 to 1.5 inches thick. Huge muscle, and the minimus on the front, smallest again, about 1 inch thick. That's a lot of muscle. These muscles will put out over a ton of pressure across your hip joint, and there's no surprise that after a lifetime of having these muscles rock solid, not massaged, not stretched, people will need hip replacements, for instance. This is the mechanism for it. These muscles get tight, stay tight, and then they compress the bone into having an unnatural joint shape. Today we're going to take a look at how to massage them with a foam roller. So first off, when we're standing, just pretend that I'm standing here, and I lift one leg up, this gluteus medius muscle is contracted. It's stopping my hips from falling over. Every time I heel strike, if I'm walking, or especially running, if I was pregnant, if I'm carrying a heavy backpack, I'm putting extra strain on this muscle. At the same time, if I'm a desk worker, my hips, when I stand, will want to stay in the seated position. When I go to stand up straight, I can't really do it, so I'll be contracting this muscle a little bit more to be in a standing position. This muscle is huge. It wants to be used explosively and then relaxed. And what we're forcing it to do in our desk working lifestyles is we're forcing it to contract at 15 or 20% of its total strength all the time. It hates that. So our bodies will tend to economize, lock off in one particular position. So that's why our hips will tend to want to stay in this somewhat seated position as we stand. Most of us do not stand comfortably. What we want to do is put a little bit of slack into this muscle. So as if my leg was slightly abducted and brought backwards. Now if I was lying on my side, I could stretch it, I could put some slack into it, I should say, by laying on my side, bringing my leg just a little bit back and putting a couple of pillows under my knee. That would be a slackened position. That's where someone could massage this muscle if they were sitting behind me, putting some elbow pressure, some knuckle pressure straight down into this muscle. We're going to turn it on its side so that we don't need a partner. We're going to put our foam roller across the muscle. So I'm putting this foam roller just between the greater trochanter on the femur and the iliac crest of my hip. So those are the two bony landmarks between which this sort of fan-shaped muscle will span. So I've got the foam roller about in the right place, but it's hard for you to see this, but if I was to totally relax this muscle, what it feels like is nothing. I can kind of feel something, and in over about 2 minutes, I can really feel it working. It takes a little bit of conscious work, sort of that yoga space mindset, to really feel this technique working. And it's subtle, but when I feel it, it's starting to kick in now. When I feel it relaxing, it's like a deep pelvic relaxation. Subtle, but you can feel it. With repetition and with a little bit of movement,